didn't write down all the names, but just so you know, it's not just one person. But anyway, I'm going to turn it over to Joe, and he is going to introduce his guests and explain what they have. We've got some toys, so to speak, right? Basically, for lack of a better term. So I'll turn it over to him. Here we go.
Hey guys, I'm Joe Weiser. I'm a urologist, and I gave this talk last year, and it's a little bit tough to give it by myself, and so I actually brought help today. So this is Isaac. He's a third-year medical student. He's going to kind of talk about what it's like to apply to medical school and kind of what you focus on in college to get there, because to become a doctor is a long process. We'll talk about that. Isaac's going to talk about medical school. This is Rick Rankins. He's a device rep for Boston Surgical. They're a big medical surgical equipment maker, and he actually brought a surgical simulator that you guys can try also, okay? And so kind of as we go, I think what we'll do to make sure that everybody gets a chance is that we'll have people come just one at a time and come up and meet with Rick, and Rick can kind of show you exactly what this is. Let me give you a real quick idea about what exactly this device is so you know what we're talking about, so Rick doesn't have to say the exact same thing to everybody. This is a surgical device for treatment of prostate problems. So the prostate is a small organ in a man that sits around the urethra, which is the tube that a man pees through, and it sits right below the bladder. And when a man pees, the urine goes through that tube, right through where the prostate is, and then it passes out. But one of the common problems that men have as we grow older is that the prostate can get big. And if the prostate's like a donut and the tube you pee through is like the donut, or goes through the donut hole, it doesn't really matter how big the donut is, but what really causes problems is when that prostate squeezes on the donut hole. So what we do with this procedure is we actually help destroy some of that prostate tissue to open up the donut hole. And this is actually a great surgical technique because for the past almost 90 years we've been doing the same procedure called a TURP. And what we do with that is we put a man completely out, so under anesthesia. We take a scope through the tube that a man pees through right into their bladder, and we scrape away the tissue, which causes a lot of bleeding, and they have to stay in the hospital and all that kind of stuff. This we can do in the office. And what we do with this is this device deploys a little needle into the prostate and injects steam, and that steam just kills the inside part of the prostate, and then a man will just slough that tissue away, and it'll open up the channel and help him pee better. So this is a really cool technology, and we really appreciate Rick for bringing this in to help show, because it's just kind of fun. In urology, we have lots and lots of different surgeries that we do, which is one of the great things about my job. And this is just one example of really one cool technology that we have. So I'm going to have Isaac start off and talk about being, getting into medical school and being a medical student. And we'll start off just in the front, and I'll have you guys come over and meet with Rick so Rick can kind of have you go through this. If you don't want to do it, you don't have to, okay? But it's just kind of neat. It's kind of like...
How do you inject the needle?
Yeah, so it's a little curved needle, and basically there's a trigger on there, and what you do is when you have it in the right place, you pull the trigger, and the needle is a curved needle that just slides right into the prostate, and it actually just, you have little holes on the side there and inject steam right through.
Where are you going through the...
Goes through the tube that you pee through, which is the hole in the penis. So, yeah.
The urethra?
So, with urology, we deal with male genitals a lot and female, and there's plenty of jokes as a result of it. So, at any rate. All right. Any other questions before we get going? Well, I work at Urology Specialist, which is just on the other side of Aspires Hospital. All right. Let's start off here. You want to come on over here? Isaac, you want to start?
Yeah, I can. So hi, I'm Isaac. I'm a medical student here in Wausau. So before I start, general question for you. How many of you have a general idea of what you want to do like after college or for college? Just a general idea. Most of you. Now, how many of you have an interest in doing something healthcare related? Doesn't have to be a doctor, but just in healthcare. So a lot of you too. And now, how many of you have any interest in doing medical school? Two. Okay, so I'm just talking to 3 or 4 of you. Well, hopefully we can change your mind just a little bit. So, little background on me. I'm from Plymouth, Minnesota originally, and I feel like I have to tell everybody that I'm not a Vikings fan, so don't hold that against me. Actually, more of a hockey player myself. So I graduated high school in 2012. When do you guys graduate? 2020 and 2021. I'll graduate medical school then. Cool. Grad buddies. I went to a small school in Illinois called Wheaton. Most of you probably haven't heard of it. And then, like I said, currently third-year medical student here at Medical College of Wisconsin. So what is medical school? So it's basically where you're going to learn how to be a doctor. So at the end of it, I'll have the little MD letters after my name. But there's a little bit more training that happens after that for me to actually go out and practice like Dr. Weiser does. So the first 2 years, it's a 4-year process generally. The first 2 years you're going to be learning a lot of basic science stuff. So anatomy, how medications work, physiology, like why people get sick and how to fix that. So it's a lot of book time and studying and tests and everything that nobody likes to do. And then the second 2 years are going to be time where you're in the clinic and hospital working with doctors and kind of learning more of the like physical exam and talking to patients and everything like that. So the average day at the first 2 years of medical school, like I said, lots of tests and lectures. So it's kind of similar to this, although all of our lectures are recorded, so if you never want to go to class, you don't have to. I went to 1 day of class my second year of medical school, so you can do that if you want. A lot of learning the basic clinical skills, like I said, and then a lot of studying and a lot of coffee. Then your next 2 years you're going to be spending in the clinic or the hospital. So you have these core specialties that everybody will spend a little bit of time in. So family medicine is just kind of your general doctor that you go to. Actually, you guys still might go into pediatricians, depends. Pediatricians are the kid doctors basically. OB-GYN are those who deliver babies. Internal medicine is going to be those doctors in the hospital when you get really sick that take care of you. And then there's surgery, psychiatry, and then some programs do neurology, which is a lot of the brain stuff, versus others will do anesthesia, which is what we do here, so putting patients under for them to go undergo surgery. And then you get to spend a lot of time rotating at things that you're interested in. So I'm interested in urology, like Dr. Weiser, so I've done a little bit of urology, and then in the future I'll do some nephrology, which is the kidneys. You guys mostly know what kidneys are, yeah? Okay. So kidney doctors, doing some wound care. Radiology is looking kind of at like x-rays and CT and MRIs. And then again, you still kind of have the lectures and the tests. It never really ends. That's just part of the process. And then you get to start applying for residency. So what is residency? This is kind of a diagram of what the entire process is from high school to becoming a doctor. And as you can see, it is a long process. I'm looking at it, it's anywhere from like 9 to 18 years from starting college to becoming a doctor, depending on what you do. So I'm right here, and next will be residency, where I get my specialized training, and you can even go to more specialized training in what's called a fellowship, or you can go straight to being a doctor. But what really matters, I think, for you guys right now is kind of this high school, the college, and then what to do after that. So kind of focus on that. And I threw in the tests that you have to take. You guys have to take SATs and ACTs still? Yeah? Do you have to take both?
I think it's just ACT.
Just ACTs? Okay, nice. That's all I had to do. And then there's another big standardized test, which is kind of the same thing, but for medical school, called the MCAT. Medical something test. I don't actually know. So what should you be doing in high school? Really, at your stage in high school, enjoy yourself and be involved in a lot of different activities, especially ones that you like. So obviously a lot of sports. I was involved in hockey when I was in high school. Doing a lot of volunteering activities, especially in things that you enjoy. So like I volunteered at the like science museum, which was fun, and it was also like teaching science to little kids, which was pretty fun, although it can get kind of rowdy. So get involved in a variety of activities, and then grades do definitely matter. So get good grades, and if not, get at least decent grades. They matter a lot for college, but I have to tell you, once you are into college, your high school grades won't matter anymore, but they're important to get to that next step of college. And then also when it comes to picking a college, pick one that fits. So I went to Wheaton. Like I said, it's a very small school in Illinois. Nobody really knows of it. But you can go from any college into medical school. Whatever college you go to won't really dictate if you can get into medical school or not. So don't be too worried about that. I think most of the people in my class went to schools like UW La Crosse or UW Stevens Point or Madison, Minnesota, and so there's a big variety of schools that you can go to, and other like small schools like mine or Concordia, I think, which is in Milwaukee. So then once you're in college, it's pretty much the same thing. Have fun and be involved in a lot of different activities, but now there's a little bit more emphasis on the grades. You gotta get great grades, and grades is mostly A's and B's, but C's won't destroy your opportunity to go to medical school. There are plenty of people in my class that had C's in college or didn't do well in a class or two. So don't get too worried about that, but definitely caring about your academics and stuff is a big part of getting into medical school. Then when it comes to picking a major, pick something you enjoy. I did biology, which is kind of a classic one, but I had a friend who did an art major with a Bible and theology minor, who then got into medical school. So you can really do anything as far as your minor. My sister-in-law is doing international relations with a Chinese double major, and she's going to medical school. So pick a major that you really enjoy and that will be useful for you, because it's really tough doing 4 years of college, sitting through something that you really hate to go to medical school. So pick something you enjoy, definitely. And then a lot of people, it's becoming more and more common after college to take a year off or several years off and doing work, like going to work or going to do research or going to do an internship or anything like that before applying to medical school. So about half of the people in my class took a year or more off. We had one who took 10 years off between college and starting medical school. I took 1 year off, so I did an internship in the Philippines for 5 months, and then I came back to Minnesota and was a medical scribe for 6 before starting. So there's a lot of opportunity to do some fun things. A lot of people travel, or at least get jobs in different countries, because it's fun and it's a change of pace before having to come back and study all the time. So it's definitely an option, and of course you can also just go straight through from high school to college to medical school to residency and stay in school your whole life. That's part of it. So do you guys have any specific questions for me? Yep.
Did you take any medical classes in high school, or did you wait till college to?
In high school, I took medical classes weren't really offered at mine. I mean, I took a lot of science classes, so like I took biology and physics and chemistry and all of those like science classes, but thinking back to high school, my high school didn't offer a lot of like medical specific courses. I know that my sister, she's a senior at the high school now, they do now, and she took them. And that's a great opportunity to kind of get exposure and see if you really do enjoy it. Because some people like the idea and then they get there and it's not that fun, and other people really love it. So I think that's a good time to get exposure to it for sure. And you can do that in college too. Then I'm done.
All right, so we'll switch this sucker over.
We just use the mouse. Yep. I think, yeah, you were the.
Bummer. I got mine. Let's see. Oh, no big deal. All right.
How long would a treatment like the other one before you?
I can get it.
All right, so I'm Joe Weiser.
That's yours.
Yeah, I should be. So I'm Joe Weiser, I'm one of the urologists, and I've been a urologist now for coming up on, I don't know, I guess it's 6.5 years now. And that's after all the training and such that we do. And kind of like Isaac had mentioned, there's a lot of time between like high school and actually getting out to working as a doctor. And there's sort of three main steps. There's, going to college, and then after college you have to apply to medical school, and then you do medical school, which is usually about 4 years. And then after that, you do what's called residency. And residency is where you actually learn the specific medicine that you're going to be doing, the specific specialty within it. And so for urology, residency is about 5 years typically. There are some that are still 6, but most of those include a 1 year of research, which if you're not going to be an academic urologist, meaning if you're not going to work at a big university, most docs try to avoid because it's just an extra year that you're waiting to go out and live your life. And a couple of things that Isaac talked about I would totally agree with. The biggest one being that if you decide that you want to be a doctor, take a year off after college before you go to medical school. Because once you start medical school, you have a tremendous amount of debt that gets built up. And you really, at that point, can't stop until you're in, working. So you have a good opportunity after college to, go out and live life and be free for a little while. Isaac said he spent half a year in the Philippines. I was a Peace Corps volunteer in Africa, and then I taught English in China for a little while, and it was fantastic. Totally recommend doing something like that. And if you still want to do medicine after that, then it's a great career, but it is a long time commitment. From the time you start medical school until you get out and practice, it's going to be at least probably 7 years. And if you're doing a surgical specialty, 9, 10, 11, 12, 13 more years. So go out and have a little bit of fun first, live a life. So what is urology? So urology is the medical and surgical specialty that deals with the urinary tract. So what are the main organs in the urinary tract? Anybody? Bladder? What else? Prostate for guys. And that's actually more like male reproductive tract, which is also what we do. What else? Uterus is actually, we consider that gynecologic, so that's a different specialty. Kidneys are definitely part of it, all right? And then a lot of the tubes that are involved in there too. So the tubes that go from the kidneys down to the bladder, what are those called? What's that? Ureter, that's right. What about the tube that goes from the bladder out? Urethra, great. So that's your urinary tract, kidneys to ureters to bladder to urethra. And then we also deal with the male reproductive system. So what do we all think of when we think of the male reproductive system? There we go. All right. Somebody had to say it. All right. The testicles, penis, right? But then also the tubes that go from those. So we got the vas deferens, and we have the prostate and the seminal vesicles. All right. And then urologists also deal with the adrenal glands, which are the small endocrine glands that sit right above the kidneys. And we're mainly involved with those because they're just in the space that we do surgery on. So they sit right above the kidneys, and we're real familiar with that space surgically, so we deal with that too. So the great thing about being a urologist is that we have such a wide range of practice. People think, well, urology, you're very, very specialized. And that's true. You just deal with the male reproductive tract. We have the widest range of surgeries of any specialty out there. We have big open surgeries. We take out very large cancers by big incisions. We do laparoscopic and robotic surgery. We do microscopic surgery. We do endoscopic cases where we take a scope up through the tubes that guys pee through or women pee through, go find stones and break apart the stones and fix things. We do a lot of office procedures. We have plenty of time that we spend in the clinic where we get to sit and talk with patients too. So we get a real large breadth of basically everything. We only deal with one, small organ system, but we get to do everything within it, which is actually a lot of fun. Plus, the fact that we deal with penises and everything means that we, generally speaking, have to have a sense of humor. So it makes the people that you work with pretty easy to get along with for the most part. I had on my PowerPoint a bunch of pictures of stuff that I've taken out, which is kind of fun to see. But it doesn't really look like it's working. So, I don't know.
Do you have anything?
It's a video of a vasectomy, it's nothing crazy, but, yeah. Nah, not this one, sorry. No, can't show that one. I can show the other stuff, but, yeah. Let's see. What questions do you guys have? Anybody here had to see a urologist? Anybody had kidney stone?
My dog had one.
Interesting thing, I have a cousin who's a vet, and she says that cats get a ton of kidney stones.
My kids ate a lot of grass.
So how long have you been in Wausau?
So I've been in Wausau for about 3.5 years, and my subspecialty is actually in complex kidney stone management, and then I also do a lot of kidney cancer surgery as well. So you get some interesting stuff that happens as a result there.
When you do deal with the kidneys, how you extract from the kidney?
Yeah.
Skulls,
Yeah, so let's say, let's talk about,
too much talking.
sure. Let's talk about kidney stones a little bit. So, I think it's probably just gonna be, I bet it just didn't transfer over this one. Yeah, that's all right. So, where is the kidney in the body? Yeah, right back here, right? Okay, so when we do surgery, what's everybody's concept of how we get to stuff surgically? Like, what's the number one tool that everybody thinks we use?
Scalpel.
Right, exactly. Yeah, that's what everybody says. In fact, I was joking with one of the surgical techs last week, because the reality of it is we use the scalpel for like 5 seconds at the beginning of the case, and after that it goes away and you basically never use it again. All right. But the interesting thing about the body is that if you want to do surgery, you're not just taking a big knife and just slashing and cutting down to where you need to be. The body is actually separated on the inside into a lot of different compartments. And the organs, as they form, actually they stick together via loose connections. Who here's a hunter? All right. Have you had to gut a deer before?
Yeah.
Definitely, right? Okay. So when you do that, and tell me how it goes. What do you do?
I don't know, I guess I cut the deer. Well, first you have to cut the butthole, and then you have to like cut up towards like the head.
Okay.
And then like you pull everything out, I guess.
Sure. So you start off here, right? You open up, and right when you make your cut into the belly, what do you encounter?
Intestines and everything.
What's that?
Intestines and everything.
Intestines, right? And what do they look like on the outside? What does the outside of them look like? Shiny, right?
Yeah.
Yeah. So there's a lining that covers all the intestines and that covers the entire inside, and that's called the peritoneum, right? And that actually is one space inside the body. If we want to get into that space, we can actually make a little nick and put a special needle right into there, and then we can actually put a bunch of air into it, and it inflates it right like a balloon. You can put a bunch of little tubes into that space, and now you can see on the inside like that. Now, when you gutted the deer, you probably weren't paying attention necessarily, because most people don't,
No.
but where were the kidneys relative to that space?
I don't know.
Yeah, right.